Today we're going to talk about muscle sparing techniques and their use in total joint replacements, particularly relating to the hip and the knee. One thing that has gained a ton of traction in the last 15 years is the anterior approach to the hip. So traditionally, the way a hip replacement was performed was what's called either a direct lateral, or some people say an anterolateral approach to the hip, which is with the patient lying on their side and an incision directly over the lateral thigh, which worked through an interval here where you had to cut through a little bit of tendon to access to the hip joint. It's worked well. It's a reliable way of doing a hip replacement, and it still works well for a lot of surgeons. Another technique was the posterior hip replacement. So this is probably the most common way it was done before 15 years ago in the United States, where a patient's hip was accessed from the back of the femur. So there's a bunch of small muscles here called the short external rotators, which had to be cut through as well as the capsule in order to access the hip from the back. That's also been very successful for a lot of surgeons, and a lot of surgeons still use that. So that's another way a hip can be done. The one that has gained the most popularity in the last 15 years or so is an anterior approach to the hip. So anterior means coming from the front, so the patient's lying on their back, and the interval is actually between two muscles. So it's directly down to the front of the hip here, and all that is actually dissected through is the anterior capsule of the hip joint. Patients seem to prefer it to some degree because the rehab's a little faster. The dislocation risk is a little bit lower, meaning the risk of popping your hip out of the joint after a hip replacement. And there's a little bit less pain. I tell you, at 6 weeks from whether you had an anterior hip replacement, an anterolateral, or a posterior hip replacement, the data says it's about the same. Stay tuned. Next week we'll be talking about muscle sparing approaches to the knee.